Hi everybody, this is Marketa. I am the ANAC Executive Director and I'm here with Roxanne Gould, our ANAC contracted lobbyist, and we have a little bit of update on the legislature front. So Roxanne, what's new this week?
First of all, I want to point out that we are socially distanced here.
Please see that.
I mean, you've seen a number of our updates. There is just so much taking place around the world, let alone the United States, but in California and in particular, you know, it's interesting times, scary times, you know, optimistic times at the moment because we're moving into phase the later stages of phase 2, and the governor had a press conference today. I'll be sending you an update later on that will give you some different COVID-19 updates, but we're getting to the stage where if you comply with a multitude of responsibilities on a checklist, then you can begin to get back to some sense of normalcy.
Yeah, but he also said that 70% of California economy is up and running. And as you know, he left the decision-making, the regional decision-making in regional hands. So it's the county public health officers that will be making the final decision who and what can and cannot open to some semblance of normalcy. So that's on the COVID part. And then, so we know that assembly members came back last Monday and Senate members came back yesterday.
Right.
This week. So how did COVID-19, how did it change our legislative process and system?
I mean, it's unprecedented, obviously. I mean, taking 8 weeks off of what would have been the busiest time in the legislative session. So I'm an example of something Marketa and I have talked about. In the Senate, they have determined, I mean, we're talking about a budget deficit of as much as potentially $54 billion. We've never seen anything at that magnitude. And so the legislature clearly, now we're in the time frame when we should be deciding what the budget is going to look like, has created priorities. At least the Senate has created priorities that say if you have bills, then they had better do something in these areas. Otherwise, they should not be advanced. And one area is...
So one area is obviously COVID, right? And COVID resources.
Yes.
The next area is...
homelessness, which the governor actually spent his entire State of the Union speech in January saying this is the #1 priority. It's clearly not, it's one of the #1 priorities at this point.
Then third, if I am not mistaken, is insurance. Insurance.
Right.
And then fourth would be additional resources to help people through this, through this time, right?
And an overarching... issue, concern is the budget.
Of course.
We of course have to develop a budget that in the next several years is going to figure out how to get us over the hurdle of this incredible budget deficit situation. We actually started in January with a $6 billion surplus.
Yeah, so that was just, you know, 8 weeks, or even like we had the surplus until beginning of March. So I think that earlier this week, the governor mentioned that almost 5 million Californians applied for unemployment insurance. He is predicting unemployment up to 25%. And also the state of California paid for the last 6 weeks, almost $14 billion in unemployment insurance. So, you know, these are massive numbers, and he already signaled that there will be some programs that will be cut. There will be many of programs seen as less of a priority. So there will be a lot of cuts to programs, to social programs, to social development, maybe even children programs. So we'll see how that goes. What is the timeline for the budget? Aren't we kind of coming close to it?
Well, we were, but they've changed a number of the deadlines because of the not being in Sacramento doing the people's business. So what they've done in the beginning stages of coming back is they have changed legislative committee hearing schedules. They are not meeting in smaller committee meeting rooms. They're meeting actually in one of the 2 largest committee meeting rooms, 4202, 4203.
And sitting 6 feet apart?
At least. And those of you that have attended Lobby Day, that's 4202, so you know which room that is.
Yeah, you know. Yeah.
And then they're talking about potentially having Assembly and Senate floor sessions in the Sacramento Memorial Auditorium so that they can
again be far
distance,
apart.
Right.
And then also, you know, interesting part is, so, you know, for those of you who actually attended our Lobby Day or who met with legislators, you've seen how very small their offices are. So are some staff members at home and some are coming, or how is it going there?
I mean, it's a very fluid situation. There actually are at least 20 legislators that I'm aware of that have signed a letter basically saying I'm either of an age that I shouldn't be exposed or I have medical pre-existing conditions where I shouldn't be exposed. There was a bill today that I was paying attention to that the assemblyman called in to testify because he didn't want to come to the Capitol. They've sort of set pretty serious rules about a legislator may have one staff person coming into the Capitol. That's probably going to be an evolving process, but it's, you know, as we're all finding our way in this new world, they're trying to still get the legislative process underway while fixing the budget debacle. And so it's still not, we had a number of high priority bills for ANAC that it's still not clear if they're going to be heard, if they're going to be able to meet that criteria that we described the Senate setting in terms of those 4 or 5 areas.
Yeah, that's very true. And also we read that that out of the 1,500 bills in the Assembly, they kind of narrowed it down to how many? One fifth, right? So yeah, so that's really, as opposed to normal regular legislative session, you know how that goes. And in the Senate, I guess that they had like 500 bills, and so I think that they were even stricter in the Senate. So they have like 100 bills or maybe 130 bills, and so even the Senate Pro Tem, Senator Toni Atkins, she had a slew of bills as her priority as the leader of the Senate, and she decided to narrow it down to 2, and then upon further reflection, she narrowed it even down just to 1, and that's the leader of the Senate. So it just tells you how very serious they are in truly assessing the relevance of each bill based on the priorities that the Senate and Assembly set as rules during these very, very strange times. So we really don't know what bills, because we still don't have calendar, right? We kind of know that they're going to be meeting, but we still don't know what bills will be heard. So we are kind of also a little bit in the dark. We just know that one bill, AB 664, right, and its companion bill in Senate Bill
1569,
will be dealing with issues of
1159,
SB 1159, and AB 664 will be dealing with issues of workers' comp and really adequate health care for healthcare professionals and frontline workers who were hurt or injured or who contracted coronavirus during the state of emergency in California. And so that is something that we met with
Assemblyman Cooper's legislative director.
Okay, right. And so what did we say?
Well, our effort was really, I mean, what they're trying to do has merit, and we think they're absolutely trying to do the right thing. We just think they didn't think about the myriad of other healthcare workers that potentially would need and deserve the workers' compensation coverage, protection. And so we proposed amendments that would definitely expand the those that would be covered under the bill. And they didn't push back at all. I mean,
they liked it. They liked it.
Absolutely.
Because the initial language was that that it just looked at healthcare workers, not just nurses, but healthcare workers in acute hospital settings. And so we brought up, how about subacute? How about SNFs? How about nursing homes? How about hospice? So we brought up that issue. So
community care settings,
because now we know that frontline workers are not only in acute care settings. And so we brought that up, and the author and their legislative director, they actually really like the idea. What they ask us to provide is data and percentage to show how many nurses are working in those settings, what are the percentages, what would be the additional budget. So we provided that. We used the BRN 2019 data, the survey data, so we actually had the numbers, and it was, I don't know, 3% or 4%. It was really small number. So we're hoping that Assemblyman Cooper would accept the amendments, and
we'll propose the same for Senator Hill's 1159.
Absolutely. So that's pretty much all we have for you right now, because we really don't know what other bills will be heard, and Roxanne keeps, her eye and ear to the ground, and because she doesn't go to the state capitol, this is the first time we're actually meeting in the office to do this recording, because we have been physically and socially distancing. Our office is still working from home. I haven't seen Teresa or Jared in 8 weeks, and so this is the first time when we actually met in the office just to give you this update. So do we have anything else?
No, we'll continue to update you. I think we're on the right path. I think things are going to get better and better, but I'm a glass half full kind of gal anyway.
I am glass half empty. I am a realist.
Perfect balance. So stay healthy.
Yeah. Look after yourself, look after your families, and thank you for all your hard work, and thank you for your dedication.
Yes.
We are ending Happy Nurses Week, and we are moving into Happy Nurses Month. So you know that Jared is working on a bunch of communications and fun stuff for you. So keep on the lookout. And once we know more, Roxanne and I will do more recording for you. And so far that's it. Thank you so much.
Stay safe.
Stay safe and stay healthy. Thank you.